Good morning, everyone, and welcome to the Eliminating Health Disparities Initiative RFP information session. I'm going to give everyone one more minute for a few people who are just joining us, and then we will get started. And welcome, Dr. Tura. Would you like to test your audio really quick before we get started? All right. Good morning again, and welcome to the Eliminating Health Disparities Initiative RFP Request for Proposals information session. My name is Bridget Palladian. I use she, her pronouns. I am a white woman in my 30s with light brown hair, and I am going to be kind of your MC and host this morning. Unfortunately, my colleague Mohammed couldn't be here with us, but for those of you who know him, he sends his regards as well. And we also have several other members of the Center for Health Equity team here this morning, who I'll introduce in just a minute. Before we get started, I just wanted to note that this session is being recorded, and we will post a recording of this information session on the EHDI RFP webpage once we've captioned it. And we will also post any questions and answers from this session on the RFP frequently asked questions or questions and answers webpage. All right, any questions before we get started? Everyone can hear me okay and see the slides? All right, well, this is our only information session that we are hosting, but again, we'll be posting this on the website for you to review later if you'd like, or for other colleagues or partners to view. And we will be hosting a couple skill building sessions coming up in the coming weeks, and I'll talk about those in a little bit. So next slide, please. A little bit about who we are. So the Center for Health Equity has grown dramatically over the last couple years. So this slide was not big enough to include all of our team members, but I wanted to at least share our leadership at the Center for Health Equity, Dr. Halkan Otura, who's with us this morning, and also Sarah Shute, our Assistant Director, also with us this morning. And then presenters. Again, unfortunately, Mohammed couldn't be here with us, but I'm here, Bridget Palladian. For many of you may know, Mohammed and I used to work very closely with these grants for a number of years and are still supporting from the background. And we'll be hiring at the Center for Health Equity 2 new EHDI grant managers who should be starting within the next month or so. So that's very exciting. We continue to grow. Dr. Tura and Sarah, would you like to introduce yourselves briefly?
Good morning, everyone. I am Sarah Shute. I use she, her pronouns. I am the Assistant Director, as Bridget mentioned, and we're just so happy to be here with you. And thank you so much for your interest and your time in advance. And we're just here to answer any questions you may have after this too. So don't hesitate to reach out. Thanks.
Good morning, everyone. So I hear echo. It's like it. Do you hear echo, Bridget?
I just did with that last phrase. Try it again.
Did you hear an echo? No. Okay. Good morning, everyone. My name is Halkan Otura. I use he, him for pronoun. And I'm the director for Center for Health Equity. Good to be with you. I think I met with grantees back in November 2021, I guess, when I first came. So good to be with you again. Thank you.
Thank you so much, Dr. Tura. Next slide. The agenda for today. So we will be walking through kind of the key details from the RFP. So just so you know, we're not sharing any different information here than what's in the RFP and on the webpage. So we're just going to be walking you through some of those key parts. So please keep this RFP, make sure you read it carefully and refer to it carefully as you put together and submit your application. So the first will be an EHDI overview and history with Dr. Helka Notura. Then I'll go over some of the EHDI program details. Then we'll talk about the application process and instructions. And then finally, we'll have some time for questions. So if you have any questions along the way, feel free to put them in the chat and we'll gather those up and answer them at the end when we have some time for questions. And again, we'll post the answers to those as well on the RFP webpage. Next slide. All right, so the RFP webpage, if you haven't already, this is a really important webpage to bookmark. It's your one-stop shop for templates, info session or skill building session registration, forms that you need, and more. Next slide. Okay, and now we'll go into the EHDI overview and history with Dr. Tura.
Thank you again. Bridget, I will stay off camera just to conserve some of the bandwidth. My internet is not doing well, so I apologize for that. I want to start with, so as you see on your slide 6, Bridget, if you can show the slide. The Minnesota legislators created the EHDI grant, as you know, back in 2001. It was collaborative effort between MGH and community of color in early 2001. So communities of color and American Indian rallied in support of this, bringing together hundreds of community members on the steps of the Capitol to support this initiative. So the goal of the program is to close the gap in health status of the population of color and American Indian as compared to with the white in 8 priority health areas. So the passing of this legislation was a recognition that traditional public health programs were always were not effective, and that the solution must come from the community. I think this is a base for our center and a philosophy we hold at the center. Community knows the solution to their problem. Community need to be meaningfully engaged, and we need to listen to the community for the solution that is needed to address inequities and disparity that we see in the community. Next slide. So as you can see on this slide, EHDI was founded on several principles. And in these principles, you see are reflected throughout the application questions and scoring criteria for this specific funding and other funding actually we have at the center. So I mentioned it a little bit earlier. Effective initiatives are co-created, right? So we don't want to create a solution to a problem and say this is a solution that you need to implement. So we want really community to meaningfully engage and co-create the work with us. And then also effective strategies are grounded in cultural knowledge and wisdom. We really strongly believe at the center that the community has the wisdom that needed to implement a program that effectively resolve or addresses and issues and disparities, inequities in the community. So community issues requires community solution. The top-down approach is really not effective, and we've seen again and again for several years that top-down approach is not effective. So community issues requires community solution. Organizations that reflect the population served are most likely to understand communities' experience, connect with communities, and effectively support community solution. The other really key component of this principle we follow is the sustainability of what we do. So sustainable projects complements related to related communities, services, and activities. So it is any effective intervention are only sustainable if communities are meaningfully engaged. Next slide, please. So as you can see on this slide, the history of EHDI, of course, I am here only for 1 year, so I I can get this history wrong, but really, this is one of the longest-standing program, and it is, I think, the foundation for Center for Health Equity today. Back in 2001, when there was a Office of Minority Health, EHDI was created back in 2001, and then at the time that EHDI legislation was passed, the grant were administered through the Office of Minority and Multicultural Health, and then first grant was out in 2002. Probably some of you were part of that and are still part of this initiative. So given what we learned from EHDI, implementing EHDI in around 2013, MDH created a Center for Health Equity to bring an overt and explicit view to really to the health equity effort. It is also, as we implement public health program in a more traditional way, we were able to learn the root causes of inequity that we see in our community, which is structural systemic. So the creation of Center for Health Equity is really to become more race, structural, system is explicit in the work that we do. And then here we are now in 2022. We are releasing the sixth iteration of EHDI RFP. Next slide, please. So this is one of the things really I probably just say this in every meeting that I go to. When I look at an MDH's effort in addressing or advancing equity, and this is one of the areas, as I always say, what attracted me to MDH is also this specific mission MDH has, as a center has, which is connecting. I think that connection is critical, connection of effort, because we are swamped in a generation of siloness, doing work in a silo. So we really work to connect health equity efforts, connect communities. I also strongly believe that most of the issues that we see in our community is due to broken relationships. So we connect, we build that relationship. We also strengthen capacity. There are every year, especially the last 2 years, we learn a lot. The structural inequities, racism surfaced very well, and COVID really revealed that, brought that to the surface, the generational operation that we had. So we really need to strengthen a capacity and bring that new understanding, create a shared understanding of what creates health, what equity is, what structural racism means, how we can become anti-racist. So we want to build that, strengthen that capacity and build that equity muscles. And of course, we amplify the voice of the community, the work of the community. So at the center, we always say, we reinforce and resource community solution, community voices, and support that. So we really amplify the work of the community most impacted by health inequities and support them to drive their own solution through targeted investment in their infrastructure, staff, and resources, and also acknowledge within MDH and our partners across the state. So building that knowledge. Community leaders who become grantees are also strengthened through opportunities to enhance their leadership skill, grow their network, and connect across culture and programs. Next slide. So this is the last I want to share with you all, and then I will give back to Bridget. Our work in Center for Health Equity is guided by a set of approaches, including racial equity. We really want to be explicit about the things that harm. We have to name it. We have to be bold in naming them. So resilience, we also really need to talk about resilience. It's just this community doesn't have only one story. There is a resilience. There is intersectionalities, communities with layers of identities experience inequity differently. So we want to really work through this intersectional lens, network leadership, community-driven data decision-making. I can speak almost the whole day if we wanted to about data and then issues in data. Really at the center, one of the things that we want to do is challenging racism in the use of public health data, and then making data equitable and inclusive for every community. And then also addressing the system that, advancing the system that heals, not harm. At the same time, our work is rooted in a value that we share, including honoring cultural knowledge and the wisdom that our community holds, fostering trust and belonging. We hone on, and then we wanna advance that and then create this sense of belonging, where community feel they belong, community they co-create their healthy future. So we want to listen deeply to our communities and community voices. As our Assistant Commissioner Cunningham say, Dr. Cunningham say, we really want to listen to community input for community impact, and a bi-directional relationship that we want to advance, and recognizing health equity as a human right. Really, when we talk about equity, we're talking about humanity. So really, those values and principles are what guide us and the work that we do. So you will see that those values and approaches are woven throughout this RFP. I should stop here, Bridget, and then I will give back to you.
Thank you so much, Dr. Tura. All right, now in this next section, I'm going to lay out the details of the EHDI program and explain the most important facets of any EHDI project. Next slide. All right, so before we begin, I'd like to do a quick poll of our attendees here, our participants here. So could you answer the poll question, have you applied for an EHDI grant before? Just to get a sense of who we're in this space with today. Have you applied to work with us before? We'll give you about 30 seconds. All right, final few seconds to answer the poll, and then we can take it down and we'll see our results. All right, thank you. And Ramya, can you help me see, are you able to see the results and share? Oh, here they are, okay. 17 out of 59 have said yes, 25 have said no, and 17 were no answer. I'm guessing a lot of those are our staff as well. So that's wonderful. It's great to see that we have lots of new potential applicants here today. It's also great to see many of you returning. We, generally with each, this is the 6th iteration of the RFP, EHDI RFP, as Dr. Halkanotura mentioned. And oftentimes we have returning grantees and we have new grantees in most of those cohorts. So great to see a mix here today. Thank you, Ramya, for helping us with the poll. All right, next slide. So as you can see with this graphic here, the EHDI program has 2 funding sources. The biggest source of funding is state general funds, and that's a little more than $3 million annually. That's on the right here in green. And that funding is specifically for projects that are laid out in state statute. So that's breast and cervical cancer prevention, cardiovascular disease, diabetes, HIV/AIDS and sexually transmitted infections, immunizations for adults and children, infant mortality and prenatal care, and injury and violence. And I just want to point out that under infant mortality and prenatal care, the prenatal care is a new addition. I believe in the 2019 session that was added to the legislation. There was no additional funding added for that, but that was added as an eligible priority health area for grantees to propose projects on and work on. So that's exciting. And then the other funding source is federal TANF funds. TANF is an acronym that I do not prefer, but that stands for Temporary Assistance for Needy Families, and that's $2 million. And that funding is exclusively for teen pregnancy prevention projects. Just to note that projects that are focused on teen pregnancy prevention and another priority health area may request and potentially receive both TANF and state general funding. So if you have a project just working on teen pregnancy prevention, you'd only request federal TANF funds. If you have a project working on one of the priority health areas in green, you would just request state general funds. If you have a project working on a combination, for example, a teen pregnancy prevention project that also works to address HIV/AIDS and sexually transmitted infections, then you may apply to receive some of both funding. And just to note that the federal TANF funding does come with a few additional restrictions from the federal government, and those are laid out very clearly in the RFP on page 16. Next slide. So this is an overview of the major dates and milestones associated with the RFP. You'll notice that the important dates coming up is the last day to submit questions. That's November 30th, so about 6 weeks away. We have that deadline before the actual proposal deadline so that we have time to answer those questions publicly for everyone to have equal access to the same information. And then a little bit of time for everyone to use that information to get their proposals in. So in red here, the proposals are due on December 19th. And we specify, that you have up until 11:59 p.m. to submit your proposal. No late proposals will be accepted. And it doesn't matter if it was just a technology glitch or something out of your control. Unfortunately, we are not allowed to accept any proposals after that deadline. So I strongly, strongly encourage you to not wait for the last minute. Every time it seems we have proposals that come in late, unfortunately, usually due to circumstances outside of someone's control. And so to prevent that, get your proposals in early. Start now. You can submit your proposal now if you'd like. You can submit it in November, in December, submit it at least, I'd say, by the 18th. So then on the 19th, you have time to ensure that everything was submitted and received. And then we anticipate giving a notice of funding decisions in mid-April of next year. And then most grants should start by July 1st, as long as our timeline continues as planned. And then these will be 4-year grants. So they will all end on June 30th, 2027. Next slide. With approximately $5 million in EHDI funding annually, we expect to award between 25 to 30 grants. And we expect that each grantee who is selected to receive a grant will receive between $100,000 and $200,000 annually. So that means that over the 4-year grant period, each grantee may receive between $400,000 and $800,000 total. And so on your application, you'll be asked how much funding you're requesting, and that's an annual amount. And then you'll receive that same amount each year if selected. Eligible applicants include, but are not limited to, faith-based organizations, social service organizations, community nonprofit organizations, tribal governments, community health boards, and community clinics. Again, this is not, these are, the types of eligible applicants, but this is not an exhaustive list. A question we get a lot is whether for-profit organizations can apply. Yes, they are eligible as well. And we also really encourage multi-organization collaboration. So we encourage partnerships. Right, next slide. All right, so as specified in the EHDI statute, this grant program serves populations of color and American Indians. And the EHDI philosophy is based on the principle of self-determination, that change must come from within communities and build on community strengths and social and human capital. While EHDI funds are focused on racial and ethnic disparities in Minnesota, as laid out in the statute, MDH recognizes the ways in which unjust systems such as racism, sexism, homophobia, transphobia, ableism, xenophobia, classism, that's just to name a few, how all of these unjust systems intersect to create interconnected layers of disadvantage and inequity. So because of that, we recognize that our approaches to equity should be intersexual and multi-pronged, as Dr. Tura mentioned earlier. This concept of intersectionality is one of our core CHE values. So therefore, applications that are focused at the intersections of race and ethnicity and other identities or communities' experience inequities are very welcomed. For example, projects may choose to focus on serving LGBTQ people of color, American Indians with disabilities, etc. This is not a requirement, but it's encouraged. And then just to note that populations of color include, but are not limited to, African Americans, African immigrants, Hispanic or Latinos, Latinas or Latine, Asian Pacific Islander. Yes, EHDI exclusively funds and supports organizations and programs working in communities of color and American Indians to develop and implement strategies targeted to their communities. So it's spelled out in the EHDI statute. Next slide, please. So I went over this earlier with the graphic, so I'll do this one quickly, but these are again, the eligible priority health areas. And I bolded the prenatal care there because that is new since 2019. And then also just want to draw attention to the fact that unintentional injuries and violence category includes many different health issues. So applicants in this area could choose to focus on a range of topics, including, again, but not limited to, falls, home fires, drug overdose, suicide, self-inflicted harm, and or sexual violence. And we lay out some data and information on all of those in Appendix J for more information, but those are some of the unintentional injuries and violence events that are most common in Minnesota. Next slide. All right, so I think for this one, we don't have an actual poll, but I just invite you to put in the chat, what priority health areas are you interested in submitting a proposal for? And again, you can apply to work on more than one priority health area. So you could work on breast and cervical cancer and infant mortality or prenatal care. That one should have infant mortality and prenatal care on there. So apologies for that, people. So let's see, awesome. I'm seeing some priority health areas too, or priority populations listed. Great, lots of diabetes, cardiovascular disease, unintentional injuries and suicide. Great, this is wonderful to see all of these different priority health areas. Thank you for sharing. Okay, next slide. Now we'll move into talking about the EHDI levels of change. And this framing of change making was included in the last RFP in 2018. And it has not changed. So if you've applied in the last round, this should be familiar to you. If you've never applied to before, or if you applied only earlier on in the life of EHDI, this might be new to you. The reason that this framing is newer is that in response to community and stakeholder feedback, and based on the EHDI philosophy of projects being community driven, funding is meant to be flexible and responsive to community needs. And a key recommendation that emerged from a 2015 community input process that the Center for Health Equity conducted was to encourage grantees to broaden program activities to address the social and economic conditions for health, also known as the social determinants of health. So our community partners over the years have recommended that the EHDI program allow, and I would say even encourage, grantees to expand beyond providing programs that target individual level changes, such as awareness, knowledge, behavior, or skill on an individual level, to instead, or in addition to, also focus on broader social determinants of health, such as changing policies, systems, or environments that address the root causes of inequities. So this, adding this eligible levels of change to the RFP is to help explicitly broaden the scope of work for grantees. So that depending on the needs of the communities served, applicants may choose to work in one or more of these levels of change. And then just a quick note before I talk through each one of these is that projects addressing any of these levels of change will be given equal weight in the selection process. So applicants may choose, whether they want to move upstream to work on these conditions for health or not, or if they want to work in more of the health promotion direct service area. So level of change 1 is, again, that health promotion direct service that often but not always focuses on individual behavior change. An example of that would be delivering a health promotion program or curriculum to prevent teen pregnancies. Another one would be providing wraparound services to high-risk pregnant or new moms to reduce infant mortality or maternal mortality. Providing exercise classes for older adults at risk of heart disease and stroke. So those are just some examples. There's lots of examples in the appendices as well in the RFP. Level 2, that is moving a little bit more upstream. So that is participating or leading in efforts that contribute to eliminating health disparities by changing organizational or institutional policies or changing the way the system in an organization or institution works. So oftentimes this means modifying policies or systems to support individual behaviors and address risk and protective factors. So for example, contributing to or promoting the adoption of teen-friendly clinic policies to support the prevention of HIV or STIs, contributing to or implementing a new policy requiring age-appropriate comprehensive sexual health curricula in a school district, or contributing to or leading the development of a statewide network for sharing best practices related to breast and cervical cancer screening. And then the third level of change is moving the furthest upstream, and that's addressing the root causes or conditions for health. So if you choose to work on this level of change, and again, you can work on more than one if you'd like, you would be participating in or leading efforts that target specific social and economic conditions for health, also known as the social determinants of health, and contribute to eliminating disparities in one or more priority health areas. Projects in this area often involve changing local, regional, tribal, or state policy, or changing the way systems work, or changing the natural or built environment to address the root causes of the disparities that we're seeing in these priority health areas. So for example, contributing to or leading the development of a coordinated policy agenda that will strengthen affordable and stable housing for pregnant moms in the state to reduce infant mortality. That would be, working on the social determinant of health that we think about as housing, or contributing to or leading an effort to eliminate stigma and discrimination against LGBTQ communities of color or American Indians so that people feel included, welcomed, and valued. So that's, changing a system or environment to affect a risk factor so that we would, ultimately reduce cases of HIV, AIDS, STIs, or teen pregnancy. Next slide, please. So Appendix A of the RFP goes into more detail on the root causes and conditions for health and what some of those are, including education, income, employment, housing, racism, discrimination, some of those that we just talked about in the previous slide. So I would recommend taking a look at that appendix for your application if you'd like to work upstream. All right, one last poll. And again, if you could put your answers in the chat, knowing, a little bit more about these levels of change, which levels of change are you interested in submitting a proposal for? And again, you can work on more than one. So please let us know in the chat. All three I'm seeing. Health promotion direct service, level 2 and or 3. Lots of level 1s combined with level 2 or 3. Great. Awesome. direct service and organizational change. Great. And that's in this last round of EHDI grants, we've had a lot of people working on multiple levels, so that's great. Again, all of these will be weighted equally in the selection process. Thank you for sharing. All right, next slide. So eligible activities and strategies. The EHDI statute states that priority will be given to projects that are research-based or based on promising strategies. So we wanted to just share with you how we think about what those two terms mean. And these classifications are fairly broad, so there's a lot of flexibility for applicants to design programs that are tailored to their communities. So promising strategies may include practice-based evidence or approaches developed over time through practice and experience, or projects grounded in the lived experience of communities of color and American Indians. Research-based projects are any projects that can be tied to or include elements that draw from published literature, whether that's qualitative or quantitative studies. We just wanted to be extra clear here that EHDI grantees are not required to use evidence-based practices. Evidence applications that include evidence-based practices will not be weighted any higher than those that do not. So any project that's based in a promising strategy or a research-based strategy is eligible and equally weighted. All projects, regardless of whether they're promising strategies and or research-based projects, must be grounded in community knowledge and wisdom, and applicants will be asked to show that in their application. Next slide. So there are two main project requirements that applicants must ensure are woven into their project, and the first of these is community engagement and collaboration. Grantees should involve community members in issue identification, problem solving, and decision making, and projects should be rooted in the community served. EHDI projects should also be designed to complement and build on other related activities or initiatives in the community. And to pursue their project goals, grantees should work together in partnership with relative stakeholders, and that may include other community organizations, local public health, other government agencies, or health systems to form or strengthen cross-sector partnerships as appropriate. Community engagement and partnership building should be ongoing throughout the grant period. Next slide. The second main requirement is that at least 10% of your award amount goes toward evaluating your project. And that's your annual award amount. So every year, if you're selected as a grantee, you will be asked to show that at least 10% of your award amount has been used in that year to evaluate your project. Evaluation is a required component for several reasons. It helps grantees know how they can improve their project and report back to their community partners and stakeholders. It helps MDH report to the state legislature, both to justify the use of public funds and to show the difference the funds make in the community. And it helps document and spread the innovative projects and strategies that grantee develop to address health issues in their community based on cultural knowledge and wisdom. So when grantees evaluate their own programs with MDH assistance, they build their own capacity for future projects and initiative. Evaluation funding may be spent on internal staff time or hiring an external evaluator contractor, but all expenses must be documented. Activities that grantees may spend their evaluation funding on range from developing a logic model and evaluation plan, developing data collection tools, collecting and analyzing evaluation data, and attending evaluation training and TA events. Those are just some of the eligible activities within that evaluation category, but there are many more. And we provide lots of technical assistance and support to grantees on that. Next slide. All right, so this next section, unfortunately, as I mentioned, Mohammed's not here with us today. So I will be doing this section as well. Then I will go into the details of how to apply. And again, all of this is laid out very clearly in the RFP. So I highly encourage you to have that reference bookmarked, pulled up when you're submitting your application. So you are strongly encouraged to submit your application via email to health.equity@state.mn.us. And again, that must be received no later than December 19th at 11:59 p.m. Please, please, please do not wait till the last minute. Don't click send at 11:59 p.m. because you don't know how long it's going to take to be received at MDH. It needs to be received at MDH no later than 11:59 p.m. So my advice is do it before that last day. If you are unable to submit via email, you may submit via mail. Our mailing address is here and in the RFP. Please submit a single unbound copy. Just paperclip your application together. Please don't use staples. That helps us get ready to distribute your application to reviewers. And it must be postmarked by December 19th. Next slide. The application instructions. So there are 5 different aspects of your application that must be submitted in order for your application to be considered complete. So please make sure you submit all 5 of these. Again, they're listed on the RFP webpage and in the RFP itself. Please note that in the last RFP in 2018, there were 4 parts. This year, there are 5 parts. There's this 5th applicant conflict of interest disclosure form. It's a very short form, but it is now required to be part of applications. Next slide. So the application form. This form can be downloaded from the EHDI RFP webpage. Applicants must have Adobe Acrobat Reader to complete the form. And that can be, if you don't have that on your computer, it can be downloaded for free from the Adobe Acrobat website. Please make sure to complete all fields in the application, and character limits are enforced automatically, and they include spaces. And that's to make sure that everybody has the same opportunity to tell their story. If you'd like to know how to bold, italicize, or underline in the application form, there are some keyboard shortcuts that we provide in the RFP on page 20. Applicants who are unable to use the PDF application form for any reason may craft their application question responses in another written format, but they must not exceed the character limits or they will not be accepted. So please make sure that you're using those character limits laid out in the application form. And we highly encourage you to use this exact form. Next slide. So the second part of your application is the work plan. Again, there's a template for this on the EHDI RFP webpage. And this work plan provides an overview of what you plan to accomplish during the first 2 years of the grant. So that'd be July 2023 through June 2024. June 2025. That's fiscal years 2024 and 25, I believe. So apologies for the date error on here, but the first 2 years of the grant. We again strongly encourage you to use the Microsoft Word template that's on the EHDI RFP webpage. Most libraries throughout Minnesota throughout the state provide free access to Microsoft Word if you don't have that on your computer. If you are unable to use the Microsoft Word template provided on the website, you may submit your work plan in another format, but please make sure that it does not exceed the page limit. So that's 12 pages. We ask that you use 11-point Calibri font, and that's just, again, to make sure that everybody has the same amount of space to tell their story and proposed plan, to make sure that it's fair. Again, please note that the work plan is only for 2 years, while the project narrative in the application form where you're describing your project, that's describing the entire 4-year project. There are tips on how to craft objectives and strategies and activities in the RFP. So please refer to that in the RFP before you complete the project narrative in the application form. And when you use this template, you can add and or delete, headings, tables, and rows as needed. Just please do not exceed 12 pages. Next slide. Let's see, here we go. So this figure here Again, this is from the RFP on page 21. This has a sample of how your project might be laid out in terms of objectives, strategies, and activities. And there's a lot more tips on this in the RFP. So I highly recommend you read through that as you craft your project and your application responses. I should note that most applicants will have more activities than pictured here. For example, you may only work on one level of change, or you may have strategies or objectives that contribute to 2 or more levels of change. So these are just a couple examples of how your project, objectives, strategies, and activities work together. But this is an oversimplified depiction. Next slide. Part 3, the budget. Applicants must submit a budget narrative and budget summary that provides an overview of how funds will be used during the first 2 years of the grant. So again, from July 2023 through June 2025. Applicants are strongly encouraged to use the Microsoft Excel template provided on the EHDI RFP webpage. Again, if you don't have Excel or the Microsoft Suite on your computer, most Minnesota libraries provide free access to Excel. But if you're unable to use the Excel template for any reason, you may submit your budget in another format as long as you provide the same information that's laid out in the template and laid out in the RFP. So there are 4 tabs, or excuse me, there are 5 tabs in this budget template. The first is instructions and examples, a sample budget. The second includes information on the MDH policy and guidance on indirect costs. Tab 3 and 4 are what you will complete. Tab 3 is where you lay out your expenses for the first 2 years. You combine those expenses into one budget for the 2-year period. So if you are applying for $100,000 annually, your budget for the first 2 years would be $200,000 in total. So you'd have staff time for 2 years in there, you'd have expenses for, for supplies for 2 years in there, etc. And it's very clearly laid out in the sample on tab 1 here. Then in tab 4, you also fill this tab out. Those are noted in red on the instructions tab. This is where you would lay out your anticipated evaluation expenses to make sure that you're budgeting for 10% of your annual award amount to be on evaluation. So again, if you have a project that's requesting $100,000 annually, you would spend $10,000 at a minimum each year on evaluating your project. So on this tab, you would show that $20,000 for those first 2 years is budgeted for evaluation. And then on tab 5, this tab will automatically provide a summary of your budget, your first 2-year budget, once you fill in tab 3 and 4. So you don't need to edit that tab at all, but you can just take a look and glance and make sure that everything looks accurate and complete. And note that you can round your expenditures to the nearest dollar if you're estimating, for example, the amount of supplies that you need. And there are detailed instructions in the RFP on pages 23 to 25. Next slide. Part 4 of the application is the due diligence form. And again, you can download that from the EHDI RFP webpage. It's the policy of the state of Minnesota to consider a grant applicant's past performance before awarding subsequent grants to them. And it requires us to conduct a financial review prior to a grant award of more than $25,000 to a nonprofit organization in order to comply with the policy on financial review of non-governmental organizations. So this is again a required part of your application, and MDH will conduct a pre-award review of finalists prior to awarding any funds in accordance with this policy. Please note that this form does ask for some attachments, and those are allowable in your application as part of this part 4 due diligence. Please note that this will not be used as part of your scoring to select grantees. This just helps us understand applicant financial and fiscal capacity and identify opportunities for TA if selected as a grantee. Next slide. Okay, and the final part of your application. Again, this is new in this iteration of the EHDI RFP due to a new policy. And this is the applicant conflict of interest disclosure form. Again, you can download it from the EHDI RFP webpage, that one-stop shop for everything you need. And this is where any applicants will disclose any actual, perceived, or potential individual or organizational conflicts of interest that exist. A disclosure will not automatically result in a removal of the applicant or grant application from the review process. This is just to help us make sure that this review process is fair, transparent, and that any conflicts of interest are documented and avoided. Next slide. If you have questions after this information session or as you're putting together your application, you can submit them through our question submission form. That there's a link to it on the RFP webpage. Here's what it looks like. You'll select a question category and then enter your question, and then we will respond to that as soon as we can within a week. And generally, RFP questions are posted every Monday on the RFP webpage by 5 p.m. usually. Next slide. The application review and selection process. So the review committee will have be representing the communities served by EHDI and MDH staff and partners. And they will review all eligible and complete applications received by the deadline. And the review committee will make recommendations to MDH, who will make final decisions based on those recommendations and scores from the review committee, and also making sure to balance by these factors below, such as the representativeness of the various priority health areas, representativeness of the population served in Minnesota, representativeness of the 3 levels of change, representativeness of the geographic distribution of services across Minnesota, and within the total funding available. And please note that the award decisions of MDH are final and not subject to appeal. Next slide. Applicants who submit a complete application before the deadline will be scored out of a scoring system of 150 possible points. There are 6 different sections to the application scoring, and the amount of points is listed here on this slide and in the RFP. I won't go through these now in the interest of time, but applicants are strongly encouraged to use this scoring criteria in the RFP Appendix B and score your own application prior to submitting it to MDH for review. So maybe have a colleague or a partner organization review your draft and score it based on these scoring principles so that you can see, I need to beef up this section. I really need to add more so that the reviewers know how our project is grounded in community values or whatever it may be, or how we're going to use these expenses to achieve our objectives. So this is hopefully to make this process as transparent as possible. Please use this as you prepare your applications. Next slide. And then again, I've referenced this before, but in appendices C through J in the RFP provide more information on all of the priority health areas. They provide, information on the extent of the health issue in Minnesota, disparities that we see in Minnesota, risk factors and protective factors, social determinants of health if you'd like to move upstream and work on some of the social determinants that affect that health area or root causes of the disparities. And then also health, contact information for priority health area specialists at MDH in each of these areas. Please note that priority health area specialists cannot give you tips on applying or help you write your application, but they can provide you with other, information such as data in Minnesota, best practices that they are aware of at the national or state level, etc. And then part 2 of each of these appendices provides examples of objectives, strategies, and activities that applicants may propose in these health areas. Just to note that this is not expected to be or intended to be a blueprint, for your project or a menu of activities to choose from. These are just some examples. We encourage you to, if you're going to be doing something similar to these examples, to make it your own and really adapt it to your community, or suggest something that's not in here at all, but that you know, because you know your community the best, is going to be effective in addressing the inequity. And then there's also some selected resources for each of the priority health areas for more information. And then I think we're getting to the end here. Just wanted to note that we have a couple skill building sessions coming up later in October. These will be virtual. You can register for the sessions on the EHDI webpage, EHDI RFP webpage. The first will be on building a case for your project. So that's, how do you sell your project in your application, whether it's research-based project or a project based on promising strategies. And then the second one on October 31st, costumes welcome, will be moving your project upstream. So if you've mostly worked in level 1, individual level change, and you want to think about moving upstream with your project, this info session or skill building session is for you. Next slide. All right, thank you. We finally gotten to the end of all of our information. Again, I just want to reiterate that all of this information is in the RFP. So that is going to be your best friend in this application process. But now I want to take a little bit of time for questions in our last few minutes here. And again, any questions that we haven't gotten to, that we aren't able to get to, make sure to put them in the chat here, and we will answer them and post them on the EHDI RFP webpage. So first question that I see here is, will these slides be posted so we can reference them later? Yes, they will be posted on the EHDI RFP webpage in addition to a recording of this session. An example of conflict of interest could be, one of the questions is an example of conflict of interest. The conflict of interest could be that, you're one of the staff within the Center for Health Equity is on your board, or is a cousin of one of your partner organizations. So, it could be an actual conflict of interest, or a perceived conflict of interest. And those definitions are written in the conflict of interest form. Another question that I saw earlier was whether the attendees today will be posted on the website, and we will not be posting the attendee list on our website. Will eligible projects need to be serving exclusively populations of color and American Indians? Yes and no. The EHDI statute states that projects must serve populations of color and American Indians. The caveat to that is that we, as I mentioned earlier, and Dr. Tour mentioned earlier, we encourage partners, as we take at the Department of Health, an intersectional lens to our work, because we know that our communities overlap and that systems of inequities intersect to create multi-dimensional layers of oppression in our society. So you can focus on, for example, LGBTQ African Americans or American Indians with disabilities. So we encourage intersectional lens, but yes, your project must focus on reaching populations of color and American Indians. Can you use a Word doc to cut and paste? I'm assuming that question is about the application form. Yes, you can draft it in Word if you'd like and cut and paste into the application form. Just please note the character limits, which include spaces. Next question I'm seeing here. Will we submit another work plan after the first 2 years? Yes, if you are selected, then in year 2, you will work with your grant manager to develop and get approved a work plan and budget for the next 2 years. But that will be after your project is off the ground. Is funding only for new projects, or can it be applied to existing projects? It can be applied to existing projects, however, it cannot replace other funding that you have. So I believe that's referenced in the statute. And I see we are at time here. It is 11 o'clock, so I want to be respectful of everyone's time. If you've entered a question in the chat, please know that we are documenting it and we will provide an answer to it on our EHDI RFP webpage. So I just want to thank you all so much for your time this morning, for your interest in working with us on addressing these health inequities in our communities. And we really look forward to seeing your application and to working with you, whether you get selected to be a grantee or not. We look forward to working with you and supporting you in your work here at the Center for Health Equity. Any final notes from my colleagues or from our leadership, Dr. Tura or Sarah? Shoot.
No, thank you so much, Bridget.
Great. Thank you so much, everyone. Have a great rest of your Friday and great weekend.
Thank you, Bridget. I was trying to unmute myself. I don't have anything. Thank you, everyone.
No problem. Thank you.